I'm Dr. Reddy. I would like to take this opportunity to educate my patients and the public on the importance of viral hepatitis. The word hepatitis signifies inflammation of the liver. Such an inflammation can happen by a variety of different viruses. There are 5 viruses which are promptly recognized as causing the illness, which is hepatitis A, B, C, D, and E. Each one of these viruses have different methods of presenting as symptoms in a patient, and there are different routes of acquiring these infections. In the United States, we have an increased burden of hepatitis B, roughly at 5.3 or 5.4 million cases, and also we have a burden of hepatitis C, where there are about 3.2 million people who are suffering from hepatitis C virus. Hepatitis A typically manifests in acute form. It is not very common. It often infects children, and when it infects the adults, it can have a more serious course if these patients have not acquired this infection before or if they have not been vaccinated. With regards to hepatitis D virus, the D virus typically manifests or presents only in those patients who have a pre-existing hepatitis B infection. So it is not very common. It is present in certain pockets of the world, but nevertheless, if a patient has hepatitis B, based upon certain symptoms and diagnostic criteria, whether such patient has hepatitis D. The combination of hepatitis B and D can be very worrisome for a given patient. Hepatitis C virus is not very common in the United States. It's more common in developing and underdeveloped countries. It is a waterborne infection, and typically it affects women, and often it can manifest in a very acute form. It can also be an acute fulminant hepatitis, which means to say that the patients can be very sick. They might be admitted to an intensive care unit, and sometimes they can also lose their life. In America, having a burden of close to 10 million people, and still 25 to 40% of the population going undiagnosed, because often these patients have no symptoms, doctors should make an effort, or hepatologists like us should be screening patients whom we consider are at risk and provide them proper treatment at an early stage. In fact, Centers for Disease Control several years ago has issued that every patient who is above the age of 50 should automatically screen for hepatitis C. Now we have excellent antiviral treatments for hepatitis B and C. Hepatitis B can be kept under check by using antiviral medications. Often it's a single drug that you take for most of your life. Hepatitis C, similarly, there are excellent drug combinations that we use and reduce the viral load in a patient and also induce remission and cure. So this was not available in the late 1990s and early 2000s, but now the presence of these antivirals which are available has been a game changer, and patients often can be cured. Unlike hepatitis B, patients who are treated for hepatitis C is only for a finite duration, which is often 3 months, unless the patients have complicated hepatitis C or somebody is suffering from cirrhosis of the liver. Now, why should we diagnose hepatitis? And why should we follow these patients? The reason being, if you have hepatitis B and C, you can progress to, in your lifetime, to develop cirrhosis of the liver, and thereafter complications from cirrhosis, and also the major complication being liver cancer. So roughly 20 to 25% of the patients who have hepatitis B can develop cirrhosis, so also patients with hepatitis C, and roughly another 20-25% of these patients can develop liver cancer. Hence, once you're diagnosed with hepatitis B, we often recommend a surveillance strategy that these patients are advised to get an ultrasound of the liver and liver function test and a cancer blood test to follow them very closely. Sometimes we also recommend for patients to either get a CT scan of the liver or an MRI of the liver for further delineation and diagnosis of any tumor and complications from these infections. Hepatitis A and E, they do not transform into chronic infections. They are typically acute illnesses and they do subside with conservative management in majority of the patients unless the disease is fulminant, which requires ICU admission for liver failure, and sometimes these patients can also die. So I'm very glad that in our practice at Digestive and Liver Disease Consultants, we have treated thousands of patients with hepatitis B and C over the past 36, 37 years. All our doctors are qualified, they are board certified to extend treatment and to diagnose these patients properly and timely. I'll certainly recommend that if you're suspicious of having this virus or as a part of your annual health checkup screen, request your doctor if you need to be checked up for the hepatitis virus so that accordingly one can diagnose, and if you do have, we can arrest the disease in its very early form and prevent from developing any morbidities or complications and also death.